Welcome to the Canadian Beef Cattle Podcast, presented by the Beef Cattle Research Council. The most popular content from beefresearch.ca, available on the go. Before we get into this week's episode, a quick message from the BCRC.
Research has shown that beef cattle have better gains and improved herd health when they are provided with consistent, high-quality stock water. Added benefits include better reproductive performance, safer watering sites, increased longevity of the water source, and improved pasture use. Producers interested in installing a new stock water system should consider factors including the time of year the system will be used, water capacity required, water source, and location. The BCRC's Watering System Calculator is a useful tool producers can use to estimate the economics associated with installing a new pumped watering system based on each unique situation. A link to the calculator can be found in the show notes. This episode is titled Remote Drug Delivery: What You Need to Know.
Cattle producers and their veterinarians see the need for remote drug delivery devices, RDDDs, when animals can't be caught or there's severe risk to the handler, and timing of treatment is critical for a favorable outcome. When a worked-up bull is in the bush, a long way from a handling facility, and needs medication, it's less stressful on a bull and safer for the handler to dart it. When dealing with younger stock, it may depend on the roping ability of the producer or the amount of open terrain as to whether darting or another method of treatment gets chosen. There is an advantage of treating young calves with pneumonia by darting because it's less stressful than handling those calves. With contagious diseases, darting may be appropriate because gathering a group of animals together increases the risk of spreading the disease, such as a case of pink eye in one animal. RDDDs have evolved from the pull syringe to the long bow, the crossbow, and finally, the dart gun. Most new purchases of equipment for cattle producers for remote drug delivery are dart guns, though a veterinary client-patient relationship with a prescription for an extra label use, dart guns are primarily used by cattle producers to deliver antimicrobials. A survey in Western Canada found producers and many veterinarians agree RDDD use is their third choice when treatment is necessary. Their first choice is the use of a handling facility, followed by roping or using a calf hook. The survey also found producers and veterinarians agree on the importance of using the devices properly and closely following proper injection techniques. Survey respondents indicated that the most common products they use in the RDDDs are low-volume macrolids, some of which have pneumonia, foot rot, and pink eye on the label. Dart guns have pros and cons. Concerns include their accuracy in delivering the proper dosage through the proper route of administration. The Beef Cattle Research Council has developed resources to help with decisions on RDDD use to stay within beef quality guidelines while being safe and avoiding any drug residues. Resources for the producers are available at beefresearch.ca and linked in the show notes. These resources include a 5-minute video, decision tree, and a review of drug delivery best practices. For veterinary clinics, the webpage also includes information about printed copies of a best practices brochure and a QR code that leads to RDDD resources for use on printed label drugs. The BCRC's RDDD decision tree provides guidance on whether to treat the animal and when it's appropriate to use an RDDD versus a handling facility. You may do this intuitively, but it's always good to consciously think about the do's and don'ts when considering using the dart gun. It's important to stick to beef quality guidelines and be sure to have an accurate diagnosis for prudent use of antimicrobials. One of the most overtreated things in cattle production is lameness caused by foot rot. There is no doubt foot rot is very responsive to antibiotics, but most times lameness is not actually foot rot, so we all need to be conscious of that. By adhering to proper dart selection, needle size, and dosage, the product should be administered correctly. In reviewing Canadian sales, over 95% of the darts are half-inch needles for subcutaneous usage. The 3/4 inch may be used for subcutaneous in large bulls. This tells us that everyone is trying to give products subcutaneously, as that is what the label is stating. Use the target supplied with the gun and make sure you have got that down pat before attempting to dart your first animal. If accuracy is good, You don't need to get too far away, 4 to 9 meters or 13 to 30 feet, and only shoot when the animal is stationary. Your accuracy in the side of the neck can be very good, especially when using the guns with scopes. It is felt that about 200 pounds should be the minimum sized animals to dart, as the target is very small and the dart could cause damage to smaller animals. The darts are getting better at fully discharging and administering the product subcutaneously if the right needle length is selected. The goal is to try and give the product the same way you would in a squeeze chute or if the animal was caught. When 2 darts are necessary, one could use the other side of the neck to make sure that the shots are spread out. Even though we are delivering the drug with an RDDD, we want to adhere to the same principles we would if we were delivering the drug by normal injection. To mitigate the risks with specific drugs, there are a couple of products to avoid using in RDDDs. Tilmacocin never should be used in an RDDD because of human safety concerns. And a product like Exceed should never be administered remotely because it needs to be given behind the ear. It should be noted that all pharmaceutical companies that make these products have been very strong advocates for them not to be used in RDDD devices. Just like with any treatment, record keeping is necessary. Also, try to recover any dispelled darts and dispose of them in a sharps container as you would any sharp use in cattle production. Discuss the right approach with your veterinarian for any medical or preventative procedure you are going to do with your cattle. Producing quality, wholesome, and safe meat should be everyone's goal. Darting for treatment is a last option and should be pretty infrequent, but if you utilize RDDDs, do so following the guidelines as close as possible.
Thank you for listening to this week's episode. You can find all relevant links and information at beefresearch.ca or in the show notes. The Beef Cattle Research Council is funded by the Canadian Beef Cattle Checkoff and strives for excellence in the production of Canadian beef, cattle, and forage through research, innovation, and extension. Tune in every Tuesday as the Canadian Beef Cattle Podcast delivers straightforward insights, expert information, and a wealth of practical knowledge for Canadian beef producers. Subscribe now.